A concussion is a traumatic brain injury caused by trauma to the head. There's no radiographic evidence of any damage to the brain, no bleeds or anything like that on CAT scan, MRI, X-ray, anything like that. However, it's basically when your brain is jarred inside your skull and it causes some damage to, not damage, but it causes some trauma to the brain. Avoid trauma to the head. So obviously avoid any kind of contact sports that you could have injury to your head. Decreases the chance of concussions if you wear helmets for things like bike riding, skateboarding, roller skating. Obviously, if you play football, you need to definitely wear a helmet. But sometimes it's inevitable. People can get them from falling and just hitting their head on the wall. So there's actually a lot of studies being done regarding this, regarding like traumatic brain injury and the resultants of the recurrent traumatic brain injuries. There has been some studies that have showed that there is some depression, anxiety, some psychological impacts as a result of the multiple concussions. But there's still a lot of studies being done as to the true cause of causal relationship between the traumatic brain injury and the psychological manifestations. I've seen concussions, and probably in the population that I see here in the urgent care, and with the college, when I see a lot of college students, it's sports related, and the kids too. They fall, hit their head, whether playing a sport, hit somebody else's head, they bump heads, but that's the most common. Car accidents also are very common in a hospital, but usually sports related. That's most common. That's a tough question. I would say that there should definitely be limited contact sports with kids. I don't think it necessarily needs to be completely eliminated, but in my professional opinion, I think that if a kid has a traumatic brain injury or concussion, that they should not be able to, continue playing the sport. If they do, and then there's a recurrence. If it was my kid, I'd be done, because I wouldn't want, the problems that can arise from the recurrent.